My role in the next 10-15 minutes is to give you get under the hood. You sort of got a feel for the car and get you to understand a little bit about what happens with the heart. Heart disease is still the most prevalent problem, and so hopefully by the end of this you would understand it a little bit, and I hopefully can motivate you to lead a healthier lifestyle. Some things which Dr. Fish has already touched. I'm going to go faster. So why talk about men's health and men's heart health is because these folks here who are watching the Super Bowl, now we couldn't predict who was going to win in the last few minutes, but I can tell you that these folks are going to have a heart problem sooner or later. So that I can predict. Now here are some statistics. This is coronary heart disease, which is in the arteries in the heart. Cerebrovascular is arteries in the neck. And peripheral arterial disease is problems in the arteries in the leg. So because the arterial circulation is very similar all over, when it afflicts one part of the body, it afflicts the others. And here are some statistics. These are a few years old, but the point here is that many millions of people suffer from vascular disease. And if we compare many causes of people dying, cancer, accidents, lung disease, this is cardiovascular disease. Look at the number of people who die because of heart disease compared to all other causes of death put together. And then why were we talking about it with reference to men? Here's the reason. When you look at men, especially in below the 65 years age group, more men suffer heart disease than women do. Now women do catch up in the postmenopausal phase, but more men have heart disease. It's an aging process. Here is younger age group, so part of it is age, part of it is our sex. The reality is that a lot of it happens not only because of just the virtue of the chronological age, but also because of our lifestyle. Over the years, as we'll talk about, things which we don't do result in occurrence of heart disease. So here's what the heart looks like. On the surface of the heart are these red tubes here. These are called arteries. The heart inside has 4 chambers, and the heart is a pump. As long as we are alive, it's going to keep pumping. And just like any other muscle in the body, it needs blood. And where does it get the blood? It gets it through these little tubes. Now if you take one of these tubes and you slice it open, this is what it looks like. Now you notice the difference between this one, this tube, and this tube. This is all plaque which built up. So think of the sink in the kitchen. Over time, if you don't take care of it, stuff is going to go down and slowly it's going to keep obstructing. And this happens because the inner lining of this artery gets damaged for a variety of reasons. We'll talk about why. And then as cholesterol is flowing through the arteries, it starts getting stuck to the wall. And one day what happens is this plaque, it sort of cracks. So the day when somebody was fine a day before and the next day suddenly has chest pain, winds up in the emergency room, has a heart attack, unfortunately dies or goes through a procedure, what happens is this plaque ruptures. So right now there's enough blood getting through that the person may not be feeling anything. But one day the plaque cracks. As blood is flowing through, it comes in contact with the yellow material within that plaque. Blood has a tendency to clot when it comes in contact with the yellow stuff. So what happens is, from a 50% blockage, a person can go to 100% blockage like this. And when that happens, there is no more blood flow down the artery. So if, let's say it's this artery, there's no more blood flow down here, and that's what leads to a heart attack, because the heart isn't getting enough blood. Heart can't do without blood through these arteries for more than a minute or two. And that's when it starts causing chest discomfort. And within 6 hours of this artery being completely closed, the heart muscle damage is permanent. And that's, I'm going to come to that at the end. If someone starts having any symptoms, they need to get to us right away, because we can do stuff to open it up. More importantly, we have to prevent this. Once you understand all this, and you know what's going on the inside, this stuff doesn't happen overnight. This stuff happened over the years. So we have to be careful now so that these arteries don't clog up. Dr. Fish mentioned smoking. A smoker's risk of a heart attack is more than twice that of non-smokers. And what happens is the arterial wall gets damaged because of this constant smoking. And there are certain cells in the body called platelets. They tend to stick together more frequently in smokers than in non-smokers. It takes about 5 to 10 years for a person to quit smoking before their risk becomes that of a non-smoker. So any of you smoking here need to recognize that you're increasing your risk quite a bit. Keeps us busy, but keeps us, gives us work to do, but you don't have to smoke. The other big problem is blood pressure. There's a lot of hypertension around. Dr. Fish mentioned the numbers. The problem is that about a third of people still don't know that they have high blood pressure. So the regular physical checkups are important. And then cholesterol. So if this sounds familiar, if you had it yesterday, day before, or you're planning to have tomorrow, this winds up in the bloodstream, and this is what gets stuck into those arteries. And again, it doesn't happen by one meal. It's these repeated meals like this which result in cholesterol. Now, when you go to get your checkup done, there's something called a lipid profile which is done. There are three numbers which you need to recognize: L, H, and triglycerides. So LDL is the bad cholesterol. You want less of that. And here are just some numbers. You don't have to remember them, but in general, we want the LDL to be below 100. If somebody has known heart disease or they're diabetic, that number needs to be less than 70. Now there's a school of thought it needs to be even lower, but so that's a moving target. HDL is good cholesterol. It's sort of a scavenger. It protects you. In men, it should be at least more than 40. There are drugs now which are in the pipeline which get these numbers over 100. We're doing trials now to see if that will help prevent some of the plaque buildup. In women, it should be at least 50. And triglycerides should be less than 150. So go home and look at your last blood work and see if you fall in these numbers. Now this guy is diabetic, but he doesn't care. These are cookies in his hands. Now diabetes is one of the most common reasons people get heart disease. Unfortunately, there's a global epidemic of diabetes because we're gaining weight, or we have a sedentary lifestyle, and that leads to this problem. Now, why is it important? Because diabetics are 2 to 4 times likely to develop heart disease. Now, once we start suspecting somebody has possibility of a blockage, or when patients come to me and want to know if they have blockages or not, what do we do? How do we figure that out? So some of you may have gone through, this test, there's a variety of tests. What we are doing here is we're making the person exercise, right? So the heart has to work harder. The heart needs more blood. It has to come down those arteries I showed you. So if there was a blockage, then there's not enough blood getting to the heart as we're exercising. And what that results in is certain changes in the electrical system of the heart, which we can pick up on this EKG here. Now we can also inject a little radioactive tracer which goes down those arteries. And if, again, if the person is exercising and the heart doesn't get enough blood down that artery, there'll be less of that radioactive tracer, and the camera picks up that signal. So we do what's called a nuclear scan. If something is wrong with either of those scans, we can go in and do what's called an angiogram. We put in a little plastic tube in the groin area. The only uncomfortable part is a little local anesthetic. We thread a plastic tube up to the heart. We inject some dye into the arteries, and this is what an artery looks like. So we can see the artery is pretty good size here, and here is this blockage. So if you think of that artery I showed you earlier, now you can make sense out of that. That's plaque sitting in here, which is why there's only a little room for the dye to go through. This is a little clot in here. There are some non-invasive tests which are out there. We use them sparingly, depending on what the indication is. This is a special kind of CAT scan. The same dye which I took and injected in the heart can be injected intravenously, and we can get some really nice looking pictures which can tell us what the arteries look like. Now, how do we know that somebody has a heart problem? So the most common symptom is pressure in the center of the chest. In some people it could be burning, it could be neck. But the thing which you have to be always aware of is if this symptom is occurring with exercise, some kind of exertion. Again, go back to the same principle, is that the heart is working harder. So if you're going uphill, you're going on a treadmill, you're going up the steps, and there is discomfort, and then it stops or it gets better when you stop, that's suggestive of possibility of a blockage. That pain could go to the neck, could go to the arm. It can be associated with some other symptoms. So any kind of chest discomfort, think of the heart. Not all chest discomfort is because of the heart, but that's the most serious. So what kind of treatments do we have for you if there is a problem? So one of the common medicines we use is aspirin. Aspirin works on certain cells called platelets, which stick together to form a clot. So by taking aspirin, we reduce the risk of heart attack and stroke. There's been some change in the guidelines If somebody wants to ask me later, we can do that. As to, we were giving aspirin to everybody who was a certain age. That recommendation from the FDA has now changed. Blood pressure medicines, cholesterol-lowering medicine. Now, this is a big issue. When a smoker comes to me or a diabetic comes to me and I find the cholesterol is, maybe the LDL is 150, and I know that person's risk is high. Maybe the father had a heart attack at the age of 40. There's a lot of resistance, especially when the person doesn't have any symptoms at that time, to take a cholesterol-lowering medicine. There is, as I said before, these blockages don't happen overnight. They happen over the next 10, 15, 20 years. So these medicines have been shown over and over again in the right person to help reduce the risk of heart disease. Control of diabetes is important. Omega-3 fatty acids we were giving, but some of the recent data is showing that it may not be as helpful as we thought. So somebody who has a significant amount of blockage, we can go in, we can open it up with a balloon. So we thread a little wire, a balloon here, and open up the artery. We can also put in these metal coils called stents. So here is another picture of this balloon. We get the balloon down to the artery, open it, bring it out, and then we can take another balloon with a stent on it, and the stent stays, the balloon comes out. Some people, we're not able to do that, so what the surgeon does is open heart surgery or bypass surgery. He takes a vein out of the leg, he hooks up one end in the aorta here, and hooks up the other end on the artery, so there's a blockage right here somewhere. Then the blood, instead of coming down like this, would go up and come around like this. So that's a bypass surgery. The thing to remember is all these treatments we do, angioplasty, bypass, they don't cure the problem. The problem is that we either had a genetic predisposition or we had an unhealthy lifestyle, and that resulted in the clogging of those arteries. We can take care of it for the time being, but those folks keep coming back to us if they don't change what led to the problem in the first place. So there is no substitute to a healthy lifestyle, no substitute to some of the medicines if one is genetically predisposed. The plumbing leads to the heart muscle getting enough blood. If the plumbing gets bad, especially when it's totally blocked and there's no blood getting to the heart muscle, the damage starts within 10 minutes, and in 6 hours all the damage is done. There's no room to recover any of the muscle. That's why as soon as there is symptoms, somebody starts having chest pressure, sweating, you start throwing up, you need to get to the hospital right away. So at St. Peter's, we have a cath lab. A cardiologist like myself who does this kind of plumbing is always available. There's a whole team. We get the person to the cath lab, and within 30 to 60 minutes, our goal is 90, but usually within 60 minutes, we'll get this artery open. We get that artery open, we restore the blood flow, we prevent some of the damage. So that's critical. We can help save somebody's life. Again, prevention is extremely important. You need to quit smoking, control your blood pressure, lose weight, exercise. So people ask, how much should I exercise? So at least about 30 minutes a day, maybe 3 to 4 times a week is very helpful. Lower your cholesterol. Everybody sort of heard of the pyramid. Again, fruits, vegetables are more important, and you have to eat less of the red meat and control sugar. At the end, it all is in our hands. Aging we can't help, the genetics we can't help, but we can help what our blood pressure looks like to a degree, we can help what our cholesterol numbers are to a degree, diabetes is something we can control. So we have to identify our unhealthy habits, replace them with healthy ones, eat for heart health. Remember that calories counts. So all that extra food we eat, as Dr. Fish pointed out earlier, winds up in a belly, and that then circulates in the blood and gets stuck to those arteries. So start walking. You have to educate yourself about the food, because this is not going to happen. At last, labeling I can understand. This one says don't eat this stuff. So you're not going to get that label. So you're going to have to educate yourself. Well, thank you very much for your attention. Hopefully I motivated a couple of people.